the body does keep the score, and your body
Yes.
will, go, that's not what I remember,
Right.
and it will
Yeah.
tell you that through going into, either, hypo or hypervigilance. So yeah.
Yeah. And I think for people to also understand that when your body does that, it's really trying to protect you. Welcome to the Medical Trauma Support Podcast, the show where we shine a light on the hidden impacts of medical trauma, explore tools for healing, and empower you to take control of your health journey. I'm Sarah, your host, a passionate advocate for trauma-informed care, somatic healing, and compassionate conversations. I'll bring you expert insights, healing strategies, and personal stories of resilience to help you feel seen, heard, and supported on your path to recovery. Hello, everyone, and welcome back to the Medical Trauma Support Podcast. Today, I have Emma Tynan with me, and she is a psychotherapist in Ireland. Hi, Emma.
Hi, how are you?
Good. Thank you for being here. I'm excited for this conversation because, for the audience, you and I have talked multiple times, and you came and did a workshop inside the Befriend Your Body community, and it was really great. There was like so much discussion. I think you're wonderful, and you help people to be able to be a little bit vulnerable. And so it was such a beautiful experience. So
Okay.
I'm glad you're here. I was hoping that we could start out with you sharing a little bit about your story and what got you to this space where you're working with people with chronic illness and medical trauma.
Well, I suppose I started my career in nursing, and I spent quite a lot of it in emergency care. And
Mhm.
like many people who end up in emergency care, they come to a point where, to be honest, you're either going to climb a ladder and, I develop your career in there, or diverse. And I didn't really want to be, higher up or more responsibility or more stress and burnout that I already had. So I actually was thinking about, doing things like a postgrad. I had or a master's or something, and I ended up doing a master's in psychotherapy. And a few reasons. Number one is because I really, really loved my own therapy. Well, one of my own therapy experiences, and I really just got drawn into it and thought it would be a really nice career choice. Then when I actually started, I probably didn't play by what I would suggest now regarding burnout. I was physically unwell. I was still doing a lot of the nursing shifts and trying to get hours done for, placement and things like that. And
Yeah.
it just was crazy. Didn't really serve its purpose at the start, but then as I kind of tried to divot more and more into that side of my career and eventually actually leave nursing, I really felt the clients that I connected with, that I felt like I really was interested in the research and was people who have been through medical trauma.
Mhm.
I think that was number one because of my own experience, but also I just really felt that there's, they talk about the clients you're drawn to and that are drawn to you. They're the clients that kept coming back,
Yeah.
and they're the clients that I really were, not looking forward to coming back. That's the wrong word when it comes to therapy, but I really felt like the work was valuable with them. So,
Yeah.
there's definitely sections of people or types of people who I don't want to work with or don't feel like I can benefit working with, and I will
Yeah.
send them off other places. But this was definitely a section of clients that I really felt I was benefiting and connecting with and had something to give. So that's really how I ended up here and ended up kind of doing research and reading into it, and then kind of being a little bit disappointed about the lack of research when I started. So there was a lot there that kind of led me to that.
Yeah. Yeah, there are so many different pieces there. So first of all, just the fact that your first career was as a nurse in the emergency room, which I think
Yeah.
y'all say a different word for it. What do you say in Ireland? for the
Yeah, we say
emergency room?
emergency
Oh, you
department.
do? I thought there was like
Yeah.
A&E or something like
Some
that.
people still say A&E. Yeah,
Yeah.
A&E. That's an emergency. Yeah,
But,
that's all it.
you know, your experience both as a nurse, experiencing the burnout on that end, and then also when people are coming into the emergency room, there are oftentimes traumatic, scary reasons for that. And so I think it's really cool, you know, and well, I'm sure it was very hard, but I also think for the clients who are working with you as a therapist now, I think it's pretty amazing that you have that past experience of, you know, a lot of the sounds they heard in the hospital, you
Yeah,
know, the smells that
yeah,
they smelled in the hospital. We know that those sensory
yeah,
memories are so powerful in
yeah.
medical trauma.
It's an interesting one because I think it's a double-edged sword sometimes, because sometimes there's this feeling of they mightn't have had the best experience.
Yeah.
And, I don't broadcast all the time, to clients that, I worked in America, but I do broadcast the type of clients I work with. But, it does sometimes come up where, it's written in my website in the About Me. So sometimes they might see it or whatever. But I do think it's an interesting one because when we talk about things like countertransference, or that I talked about this before, being in that role sometimes can be challenging, or that I had been in that role can be
Yeah.
challenging for clients because they have maybe not had the best experience, and I was part of that system.
Yeah.
But then in another, piece, when you're talking about learning about sounds and that I became trauma informed through my
Yes.
studies, but I wasn't trauma informed when I was before that. So
Yeah.
I kind of think it's, even when I was doing both, I definitely think studying psychotherapy made me a better nurse, and being a nurse did make me, especially working with these clients, does help. Yeah, I just think it's interesting. It's not always, but not that it's not always beneficial. I think it's actually good to challenge.
Yes.
If they're bringing in, oh, are you another one that's going to like dismiss or be, and I think it's actually good then that it's
Yeah.
there in the room, and they can, use it to maybe, see, okay, maybe not. And, that actually this experience is beneficial. But yeah, it's interesting. Not everybody sees it as a benefit straight away because of their experience. Because maybe that's,
Yes.
yeah.
That makes so much sense. And I think that's one of the things that has been really informative too about this podcast for me is hearing the stories from all the different perspectives, right? And I think that that can be so helpful for people who have been harmed in the medical system, is to start to see the people that are working in the medical system as fellow humans who are showing up into the system that isn't supporting them.
Yeah.
And, you know, you talk about burnout, you talk about the intensity of what it's like to work in the medical setting.
Yeah.
Maybe not every single medical setting is as intense, but the emergency room is an intense setting to be in. And so I feel like the more that we can kind of open up a little bit and look at all the parts of this
Yeah.
and see that, you know, maybe somebody who had the experience of experiencing some harm and maybe being with medical providers that were super burnout, had compassion fatigue. I'm hoping that by hearing from people that have been in the system and are trying to change the system, and like you
Yeah.
said, somebody like you who was not originally trauma informed and then became educated and changed the way that you practiced as a nurse. I just think this information is so important for people to hear.
Yeah, I think it changed the way I think about things. I don't think I
Yeah,
ever was the type of person who like wasn't empathetic or whatever. But I think being truly understand. I think when you're in that role, you're trying to like look after them and move them on, because it's not a place you want them to stay. It's a move
right.
on. You can't it's good if you don't stay here. Well,
Yeah,
obviously in certain circumstances not, but your biggest goal is to. But now I'm more kind of thinking about, well, what happens after? and
Yeah.
what was that experience like for them? And I do think it's important not to push, because it's not about me, like, oh, I know what it's like, and but I do think it brings a certain line of empathy, if
Yeah.
you're a little bit more aware, and obviously the knowledge of the system helps on that, but I do think that, yeah, that little piece of just having that little bit more of even the question of what has it been like for them and what it has been like for them after is
Yeah.
a big one. So yeah, I do think it has changed the way I think. Um, yeah, it's kind of, but it wasn't my job before to, question what
Right.
now it is. So that's the
Yeah.
other point. Yeah, I'm wearing a different hat now.
Yeah. But that also makes me think of a topic that you and I wanted to make sure that we covered here. And that is to go back to that medical setting, right? Of oftentimes with medical trauma, where people were harmed is a place they have to go back to again because they're a
Yeah,
human with a body. And I
yeah,
shouldn't say have to, right? We do, it is a choice.
yeah.
But if we want to get medical care, we have to step back into the system.
Yeah, and I think that's a really, really difficult one because, and I think that's why therapy is so important in one way. Now, you can't prepare and say this is the date and we'll slowly build up to you going back to A&E or getting sick again, or they're going to tell you the date of your surgeries, and be
Yeah.
really, stick to it and all of those things. In an ideal world, we'd make small steps and build up to it and whatever, but medical stuff doesn't work that way. And then it's interesting you say about the environment. You might have the most compassionate, caring nurse or doctor or whatever in their triage or they're checking them in, but they have limited time. They don't have time to sit there and go, this is really hard for you, you're back, you're blah, blah. They have to, there's this kind of other side to it as well. So it is a really unique thing, that you can be thrust into the place where the trauma occurred and have no choice over it, or little or no choice over it. And even if the people, which I hope they are really lovely and caring, they can't sit and have therapy with you, or sit and then people mightn't have the most supportive family or friends or whatever.
Yeah.
So often people will be in that situation. So yeah, it is unique in that it is unique, I suppose, from other traumas. You think about triggers or what the cause of the trauma and
Mm.
removing somebody from harm. It's unique, and also that it's doing harm isn't that you're coming in and being re-triggered and maybe even be re-traumatized, but you also might be cared for. Your arm might be broken and it's fixed, or you need surgery, or you need antibiotics, or you need whatever. So it's a double-edged sword. Nobody can say that about somewhere else. You go back to the home that the trauma was, or you go back to wherever place you face trauma and you have to go back and smell the smells and do. There isn't care there as well. So that's also quite complicated with this, that
Yeah. That's the thing that is like coming up for me as you're explaining this is, yeah, just how it's not like a super clean,
yeah,
right, cut and dry kind of experience. It's very there's so many kind of like mixed emotions, and you may have just a fabulous doctor that you've always had a great relationship with, but it was scary and there was trauma and you felt
yeah,
pain. And then, so, you think about kind of the confusion of this. I have this great doctor and they've taken such great care of me, but that was really scary and painful. And it took me a long time to recover. And here I am back here. And whereas, you said like some other traumas people experience are a little bit more cut and dry, like maybe somebody is assaulted
yeah.
somewhere and they
And
can
I
avoid
do I
that
do
part
want
of
to be very
town.
clear. I am talking about adults, because children cannot walk away or move away. So
Right.
I think that's something that, when we talk about trauma, it's quite powerful that when you are now an adult, I'm out of that house or I'm out of that place. So children don't necessarily have that option.
Oh,
They're
I
being
know.
fed there, hopefully they're being, whatever. So they don't have that option. So I'm being very clear that I only work with adults, because I'm sure there's people listening to this going, well, that's not actually true.
Right.
There is also the way things are now, a lot of people who are stuck in the place of trauma because of financial issues too, which is fair. But I do think that medical trauma for adults in particular is unique, that I go because I need something. I
Yeah.
need like care, a different type of care, but I know that I'm going to feel incredibly unsafe and horrible and, maybe even have a panic attack coming back. But I
Yeah.
do need these antibiotics, or I do
Yes.
need this, and they're, hopefully going to look after me, that side of things. So it is, it's muddy. It's a grey, it's a grey place. Yeah.
Yeah. And
Yeah.
it's also, you may have had some wonderful practitioners or medical providers, and you may have had some that weren't wonderful for whatever reason. And
Yeah.
again, there that's kind of confusing. Like who's coming in? Who's going to come into my room today? And that can be really hard.
Yeah, of course it can.
Yeah. So I'm so glad you said that, because I think it is really important that we validate that experience for people. I think for people that are listening, know that I think sometimes we can think we're the only one, right? So like for people to listening to hear that, like
Yeah.
you're not the only one who has a fear about stepping back into the medical
Yeah.
system. That is an incredibly common experience, and avoidance of medical care is also incredibly common. This is a big reason why. This is a huge reason why is medical trauma. You even mentioned like financial. There's also financial reasons in the US why people avoid medical care because
Yeah, of
it's so
course.
expensive and
Yeah,
a lot of people
absolutely.
are
Yeah.
uninsured. But I think this is one of the layers of medical trauma that makes it different from a lot of other traumas. It's this piece because we are humans with bodies that need care.
Yeah.
And so I guess what that's really making me think of too is to go to how you work with clients, how you prepare them for that. Because while you do a lot of work with medical trauma, a lot of your work is also with people who experience chronic illness. And
Yeah.
so I'm curious how you work with your clients, knowing they're going to have to step back into the system at some point if they want medical care.
I think the biggest piece of work is, when you say about prepare, is that we mightn't be prepared. As in that, I suppose the biggest piece of work is in that if you have a date for something and it's solid, okay, we'll work towards it. And you can do little things like little bits of exposure. Can you drive and sit in the car park for 5 minutes and 10 tomorrow and whatever, and we can really slowly build up and trying to really check in that you're safe and blah 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 and all those things, and who you're bringing with you and what have you. However, that is preparation, exposure, and it's great, but anything can go sideways when it's something medical, as you said. Who I get to take care of me, if there's going to be complications, if the wait is longer than I thought it was going to be, whatever. And also, there can be an emergency or a reason why you're in even before that. So I think the biggest piece of work is in that, are you okay with not being prepared? What do we do? What's our plan of action with falling apart? So if I fall apart, have I somebody with me who's not falling apart? And, things like, you know, I went in and they said that I was going to need a cannula or whatever, and I couldn't do it. Okay, can we go back? That it's not that they're beating themselves up that it didn't happen, or that while it was happening now I was shaking, or there's a piece there of having no expectation on yourself that you are going to keep yourself together, that it is
Mhm.
understandable that if you don't. That's the first big piece, is that you
Yeah.
might fail at this, trying to be calm and collected and whatever. Second piece is who's with you.
Yeah.
What would you like them to do when I fall apart or whatever? And third piece is, yeah, we'll use different techniques. Okay, so if I'm shaking, or if my chest feels like it's going to explode or whatever, loads of different kind of grounding things and techniques and breathing and whatever. But my question always is, okay, you can have all the grounding techniques and what helps you. Some people will do things like they'll start counting the ceiling tiles. They will start talking to, say, to their partner, talk to me about that show we're watching, or I'm going to start watching something particular on the phone, or I'm going to go, how many names can I name with A, B, C, D? All of these things, just anything that's something, or they'll try and get their who's with them to try and make them laugh or show them something to.
Mhm.
And that's great. You kind of, it depends on the person what might work. But my question is, what if it doesn't work? Where do we go then? And the biggest piece is that we don't go into it. Oh my God, I can't believe I lost it, or I had a panic attack in the middle of the room, or I didn't ask him what I was meant to because I didn't have any words, or I froze, or I made a show of myself, or whatever. That piece needs to go. That's the
I love
biggest
that
piece,
phrase. Emma, I made a
because
show of
that
myself.
might absolutely happen because you have been thrust back into a place where you've had trauma. You should not be expected to act normal, or as normal as people say. So
Right.
we absolutely, and I'm a big advocate of being very integrative in a therapy room. I would absolutely go through loads of different trauma-informed coping skills. I know loads of people do the EJMR things or the grounding and things like that. I always think, and they might absolutely help and sometimes work, but sometimes they mightn't, because it's not preparing for you to be thrust back in so quickly, potentially, and maybe not a planned manner either. So I think that's the biggest piece for people, that they let
Yeah.
go of that. I should be this. I
Right.
should be the person that isn't pacing the corridor, or shaking, or frozen, or crying, or have to leave, or whatever. That needs to go before you start any of that.
Yes, to me, that's just like recognizing that you are human. We are human. And this is another reason why I'm so obsessed with nervous system education,
Mm,
is because when we understand more about our nervous system and the responses that we have to
yeah.
stepping back into a traumatic space or smelling the soap from the hospital, instead of thinking there's something wrong with you for shaking or wrong with you for making a show of yourself, which I love that phrase. That's so fun.
That's a very nice.
Before, so understanding your nervous system, then you know why these things are happening, and you know
Yeah,
these things are
yeah,
happening because I'm a human with a nervous system.
yeah.
There's nothing wrong with me. Of course, I'm going to shake because the last time I was here, I thought I was going to die. So, of course, when I walk back in there, it would be weird if I didn't shake.
Yeah, and there's loads of things like with the window of tolerance piece, especially when it comes to trauma, about going into like hypo
Yeah,
vigilance, and that piece about being coming back into a calm window of tolerance. And that's what I was talking about. You absolutely can work on that, and your body's going into weird alarm bells.
yes,
Sometimes it doesn't need the alarm bells, because I'm not going to die this time. I'm only
right,
going to make blah, and I'm only going to, people will go into complete nothing,
right. Collapse.
speechless, wouldn't
Yeah,
even be able. And you can absolutely work on getting that person back into, a window of tolerance where they are in a lot better place and they can recognize they're safe. But that's work. That's
yeah.
a lot of
And
work in a
time,
therapy room. So
time.
if you have, that experience, and 3 weeks later you're back in the same, it is a lot to ask of somebody to go, well, weren't we doing that work in the therapy room that you couldn't just, it's can be quite a lot of work. It's not
Yes,
a, one session solution. So I think that that's really important, that, you know, you have even psychoeducation, and as you said, what your nervous system is like, and what it's like to experience trauma, and the experiences are like, that somebody can even say, I went into fight or flight and this is what I did, or
right.
that can be powerful. And it also can be a little bit, you know getting the widening your window of tolerance each time. So it's not about, next time I go in, I'm going to be, it's, the 10th time I'm in, and hopefully people aren't in 10 times, but some people are. And if you have chronic illness and you're, on constant, treatments, and on constant in and out of A&E, or in and out of the wards and whatever, you might be. So there's that. Each time it's easier. Each time the window is getting wider and wider because of the work I'm doing. So I think there is that piece about sometimes, how do I go in and this doesn't happen? Okay, let's just, I think there's a little bit of a step back there as well.
I think this is interesting too, is so many of us don't realize that the person next to us is feeling the same way,
Yes.
right?
Yeah.
I want everybody listening to this to realize when you go into a waiting room, even for just like a regular checkup, you're not the only anxious person in that room.
Yeah.
Look
Yeah.
around the room and be like, you know what? I bet at least half of these people are really nervous and they're trying to hide it and seem normal in quotations
Mm.
for people that aren't watching the video. That was in quotations. Um, because,
I did quotation, I said it too.
it can be scary. Even if you haven't had a really significant medical trauma, it can still feel scary. And so,
It is.
you go in that waiting room and you look around and you smile at somebody else and you just realize, that person I smiled at, I bet they're nervous and they're
And
trying to hide
you
it.
can imagine what that nervous is like if the last time you were there, as you said, you almost died.
Right.
That's a different thing. And it's
Yes.
interesting, you can see this. I always describe the piece about getting back into a car after you've had a near-death experience or something
Yes.
really in a car. And it's the only time I think about, well, it's kind of similar because a lot of people are like, I need to drive. I can't just not be driving.
Right.
There's that piece about, it is kind of that similar feeling of how can you tell me I'm going to be safe in this car when last time it flipped over and I nearly died? And it's
Right.
similar with how can you tell me I'm going to be, and people will logically tell themselves they'll be fine, that this is a lovely nurse, or they're very good here and I trust this person and I'm safe and it isn't the same as last time. But your body, and I know this is like, probably the most quoted thing for therapists, but the body does keep the score and your body
Yes.
will go, that's not what I remember, and it will, tell you that. And it will tell you that through going into, either, hypo or hypervigilance. So, yeah.
Yeah. And I think for people to also understand that when your body does that, it's really trying to protect you. It can be so
Yeah.
uncomfortable to be terrified and like
Yeah.
shaking and
Yeah.
not able to think clearly. But like for me, knowing that my body is like, it's this little protector and it's trying its best to tell me, like, get out of there. It is not safe. Remember what happened last time? So
Yeah.
just to remember that the body is really trying to keep us
Yeah.
safe, even
I
though
think it's
it
a
is so
big
uncomfortable.
thing. I always ask, when people go into that state, did you thank it for coming? Because there's this piece of it came to protect you, even though it was in the wrong time. It's like ringing the ambulance and then there's actually nothing wrong with the person, but they did really think there was something wrong. But an ambulance is really important. It's here for
Yeah.
emergencies, and that's there for emergencies. That feeling is really important if you see smoke and you need to get out of the building. Really important, or if somebody's
Yeah.
chasing you or whatever. But maybe you're not then. You're actually okay. So that's a big piece I always think is important of going, thanks for coming,
Right.
but I actually don't need you.
Yeah.
And I think psychoeducation is important for loved ones and people, hopefully, and this isn't always possible for people, but bringing somebody that understand is also informed by this,
Yeah.
because they turn around and they realize my loved one is mute now or
Yeah.
can't. So none of this, as I said, what happens when none of it works? I can't be going, I didn't even think about if what Emma was talking about, about window, it's all it
Yeah.
went out the window. All I can think about is, oh my God, nothing. I'm just, in this. To have somebody beside you, as you said, looking around the waiting room, who knows you and
Yeah.
can go, oh, they're gone into a state where they
Mhm.
are like, can't talk in, that's really important,
Yeah.
because all that person might do is either put their hand on your knee, they might just do something really simple. They might, and I think that's why it's really important that others around people are informed about things like what it is like to be triggered, which is
Right.
talked about in pop culture so much, but But it is true, like what it is like to be triggered, and what it is like, what they look like when they are being triggered, what they look like when
Right.
they are in, and how to react. So I think that's really important as well, because
Yes.
people take this on themselves, and think, I'll have the coping skills now. But sometimes when it's really, really raw, I think it's important that they have support outside
Absolutely.
themselves.
I would love to normalize it that we all walk in with somebody who we feel really safe with and who cares about us. We
Mm,
walk into every appointment like that, right?
yeah.
Because for a million reasons, but yeah, when we get like frozen because we're re-triggered, there's so much
Mm,
fear, to have somebody there with us, like you said, to put a grounding hand on us, but also to remember the things that the doctor's saying because,
yeah. Yeah.
I know it's,
People forget. Yeah.
yeah,
Yeah.
because you're literally, your brain
Yeah.
isn't functioning in that way
Yeah.
because your whole body, your whole system is like,
Yeah. And
how do I get out?
and it's interesting, it is important, things like COVID took that away from people, which I
Yeah,
thought made things incredibly hard, and
yeah,
obviously necessarily, but, and also not everybody has that.
right.
People will either have nobody, or they will sometimes have supports that have come in, like, but I just say, like, I don't know if that's in, like, guns blazing. And
Yes,
it's great to be an advocate, but when you are already frozen, or you're already, and then your person's coming in to support you, hasn't looked at you, answering the questions for you, and is really like, guns blazing, which is a lot of them wanting to care. But there is a little bit of, okay, we're already up here and, in panic. Are you adding to it? Or are you actually, or are you trying to, diffuse situation and, be a little bit more? So that can be another thing as well. And in a lot of reasons, that's because their support system is also panicked. They're like, you need to, so um, it is
someone you can
easy to
co-regulate with.
say, but not everybody has it. Yeah,
Right. Yeah. Because what we do really need is that person who is, their nervous system is regulated so that we can
exactly.
co-regulate
Yeah,
with them. And
yeah,
sometimes you get it from your medical provider. I've had that experience of
yeah,
feeling like I'm a trapped animal and I need to get out.
yeah,
And then I've had this wonderful provider sit down with me, and all of a sudden I just felt like, oh, I'm safe. And it's because they felt
yeah,
safe. They were regulated. I could co-regulate with them.
yeah,
And so if you have someone in your life who is able to regulate their nervous system, bring them with you
yeah.
to the appointment.
Yeah, it's interesting. I recently did a course on compassionate trauma informed care. There's a girl called Lisa Healy did it, and she's just incredible. And one of the things I really took away from it was, well, what you do if somebody goes mute, or they're so far gone into hyper or hypo, and her one thing she stuck with was, you stay in the window of tolerance.
Yes.
You do not join them. You
Right.
do not panic and go, oh my God, what do I do? Or you stay. And there was something like that. You stay there, it's consistent until they realize, oh no, this is safe, that this person
Right.
is safe, this space. And just that could take ages, depending on how heavy that trauma is. So it
Yeah.
was really something that I really took away from it, and I thought it was so powerful. But also, it can come with patience. You have to be patient as well with this. That it isn't. There's something underestimated about that. How hard it can be to sit there and be that presence and consistent presence while you're watching somebody be in such a difficult space. It's
Yeah.
really easy to join them either in panic or that high. And sometimes that high people will become like a little bit defensive, or, going, God, calm down, or,
They go into
join them with
fight,
it.
right?
Yeah.
They're in fight.
Yeah.
They've got that
Yeah.
irritability.
Yeah.
It makes me
Yeah.
think a lot about being a parent as we are taking our kids to
Mm,
a medical experience, or maybe something that isn't a medical experience, but how they really need us to take care of ourselves so that
yeah.
we can be that person that they can co-regulate with.
Mm,
And so my kids know, like, I'm doing my own regulation things while we're at a doctor's appointment. I'm doing my own like straw breath as I'm sitting there with them. I'm doing, because it's okay as the support person to be
yeah.
doing your tools that keep you
Yeah.
regulated.
Yeah.
I'm
I
gonna,
think it's okay for people who have been through, and a lot of people will have been on a journey, really difficult medical journey with their loved one,
yes,
that it is okay if you can't be that person. If you are the
yes,
person that's going to panic with them, that's okay. You have experienced this too. Can we have
yes,
somebody else? Or can you
yes.
work, as you said, I'll do my own work so I can be that person. Don't have the expectation on yourself as well, because you might have been through this just as much as the person.
My gosh, yes. That's my story. I mean, that's Emma, the whole thing that got me into the medical trauma space is originally that experience of being the
Yeah,
caregiver for one of my children who's a baby at the
yeah,
time. And I'm happy that we're talking about this. Is kind of is a little different than what we started with, right? But I do think that it's important to acknowledge that there are many caregivers who also experience trauma
of course there is.
through the experience of being so scared about their loved one, whether it's a child or a partner or a parent. It's really hard. And yes, as the parent, you want to go back and you want to be there for your kids for all the appointments. And so a big part of that for me was having to, not with my child, obviously, with a therapist, process that so that I could get myself ready to be as regulated as I could in those experiences. And I also, want to let parents know that any caregiver really, that there's no perfect. There's no perfect. So
No,
let's say you've done all this work and you've prepared yourself and you walk in with your kid and your heart is pounding and you can't keep yourself regulated. You are human. I am proud of you. I'm proud
I
of you
do
for
think that,
stepping back
yeah.
into it.
Exactly. I
Yeah,
think it's interesting as well because a lot of times people will put that expectation on themselves of, but I'm not the one that had this, or I'm not the one that went through
right,
this, and I need to be strong for them. And yeah, you mightn't have been the one that physically went
right.
through the medical stuff, but you were there and
Yeah,
you had the same fears. And I do think that that's really high, maybe even unrealistic expectation on somebody that you're meant to dust yourself off and now I'll be, say it's just not fair,
right.
so
It's not.
yeah.
And really these things we're talking about are ideals, right? We're human. No one is perfect. We are all going to get dysregulated. We are all going
Mm,
to have times where we're shaking and we're scared or we, flip out a little bit. We go into fight. We might be a little bit harsh with somebody and then leave and feel so bad about it. Like I want to just like that is not uncommon. You're just human if that happens to you, right?
yeah.
That's just part of
Yeah, and
being
I
human.
think even the list of things like, having somebody support you or navigate, that's an ideal for some people. That doesn't
Right.
exist for some people.
Right.
We talk about things like accommodations, what you can and can't do in the space. There's
Yeah.
great grounding techniques there. There's lots of people who physically or just cannot do them or
Yeah.
in a space that they're not possible. There's too much rushing and they're being brought from one place to another, and loads of different reasons why this isn't an ideal setting, you
Yeah.
know. And that's why it is important to point out as well. We can have all the good plans and good preparation in the world. And in an ideal world, you'll have lots of supportive people who definitely get what trauma is and get what it's
Right.
like for you. It's not always going to happen. In a lot of
No.
play, you will find in a lot of times it isn't for people.
Well, I was going to say something. It kind of made me laugh a little bit because my husband jokes about the phrase that Mike Tyson said, "What everyone has a plan until they get punched in the face." We can all have the plan, and then when the really scary thing happens, sometimes that flies out the window.
Yeah.
Like we are all doing our best that we can, and so have some compassion for yourself. Give yourself a little hug. Be like, you know what? I was doing the best that I could, whether you are the person that was the patient or you're the caregiver or the support person that's there. I mean, honestly, the fact that somebody's listening to this podcast even is like good points, right? Like you're literally trying to learn things to make little shifts. And So that
Yeah.
alone says something,
Yeah.
right? Like you're in
Yeah.
this process of trying. That's
I
huge.
think it's an interesting one, the self-compassion piece when you say about hooking yourself, because um, when you have certain generations in front of you, or a lot of times males in front of you, that kind of talk really sometimes makes them go, "What? You want me to, even if I, fell apart and really struggled and then left, or whatever, you want me to hug myself or tell me I did a good job or I'm proud?" It is probably, and that sometimes is a big barrier in the work. Sometimes I rephrase things like that.
Yeah. Yeah.
But there is a piece there of even a work of hard to give themselves that,
Yeah.
because I wasn't cool, calm, and collected. And maybe I was afraid, which sometimes is very hard for people to label as well. So, some
Yeah.
part of the work is actually around things like that. How
Right.
culturally, or they didn't not, it's not normal to them to do something like that,
Yeah.
Ironically, some people are like, "Oh, that's very American. That's what we
Hmm.
think
That's what
Americans
I was
do."
thinking when you said that.
Yeah, it is. That's what people will say.
Yeah.
But that's why I kind of rephrase things. And I think a lot of things like, well, somebody you care for has gone through this and they come out and they're in floods of tears, or they're shaking, or they're whatever. And usually the reaction changes. Usually it's okay then to hug your daughter or to give them, and usually that's okay. So there is that kind of thing of, then why not you? And then there's a whole bigger piece of work with that too. So I
Right.
think it's interesting when we just say, "Oh, just hug her." Not for everybody. It's not that easy. They've been trained to
Absolutely.
think so, and to think that that is ridiculous.
Well, and also I do think a lot of times when people have experienced trauma, whether it's medical or not, there can be a little bit of a self-loathing piece that
Absolutely.
comes from trauma.
Yeah.
And so that's also a piece, whether even if they grew up in a culture where people are like hugging
Yeah.
themselves and self-compassion,
Yeah.
there is a little bit of that piece of like, no, I don't deserve that. I
Yeah,
don't
it's
deserve
true.
that. So no.
Yeah.
Yeah, it's interesting too with like the name of my community, Befriend Your Body. And I talk about that. And I think some people are like, that's not even a possibility for me because they hate their body at the time. And I will say in my own personal journey, I've gone from, pretty far extreme to this place where I have been able to build a relationship with my body. So like I really get it. And I
Yeah.
also just have a dream that, I mean, how beautiful if we could all get to the place where we could have some of that self-compassion and love for
Yeah.
ourselves.
And I always am very clear, you don't need to broadcast it, that you whisper
You
to
don't have to
yourself
tell anyone if you don't.
really well. There's this thing of, I think, people really struggle with the piece about, you might, if your goal is to go in there and be cool, calm, collected, and everything go well, and you're fine, and you're going to be the best advocate for yourself, and you're going to do things there, and it doesn't fully work out.
Yeah.
We're still going to leave and work on, you did really well
Yeah.
for surviving that. You don't need to tell anybody that you told yourself that. Sometimes you have to work on that you believe it, and
Right.
that we're still going to show yourself compassion, and we're still going to care for you and everything like that, even if it didn't work out like the way. So I think that can be a big piece in itself, and can be a foreign piece for people.
Absolutely. Yeah. Emma, this was such a good conversation. And I love that it kind of morphed from what we originally were like
Yeah,
planning to talk
it's
about, but
okay. It can be
it
good.
was so interesting. I love this so much. And
Yeah.
I don't feel like I've really been able to dive this deep into this piece with anyone on the podcast yet. So I'm so happy that we did it. But before we wrap up, I just wanted to know if there's anything that you wanted to really leave the audience with.
The biggest thing is, like, because it's come up actually a few times lately, where I often think when you meet somebody in the street and you hear that they've gone through something medical and they've gotten what we label as good news, or, that something has, a lot of people are so happy for them, and that is so lovely. And I would hear a lot of times people I hear that you're getting this now and it's improving, or hear that you're in remission or whatever, and you must be going back to work soon. You must be doing this soon. You must be doing that. And for a lot of people, what comes with that is a lot of fear and a
Yeah.
lot of, oh my God, am I meant to be going back to the person I was? And is people expecting me to be a certain type of person? And are people expecting me to be absolutely delighted that this is over or I survived? Or actually they've been through something that was incredibly difficult and
Mm-hmm.
traumatic. And just to be aware of that, it's not always as black and white as in they're here, they're not here. I think some people think, oh, they're in the shop, they're buying stuff, they're doing things. There can be a whole different mixture of things behind that that's actually still incredibly hard. And that
Yes.
goes with chronic illness as well, especially if you can't see it. Often when I often ask, just ask them how they are. And
Right.
if they don't want to talk about something else. So,
Yes.
because some people will come and go, I'm delighted for you. Or, and a lot of times people will come up with self expectation or a little self critic of going, should I be also delighted? Should I be also, so that's just to be aware that it's not always
Yeah.
as black and white. Yeah.
Yeah, definitely. Thank you. For people that are listening who want to like know more about your work and find you, and maybe people in Ireland who would love to work with you, like how do they get in contact with you?
Yeah, so my website is emmatynan.counselling.ie, and I work online and I also work face to face in Athlone. And my Instagram is the medical trauma therapist.
Mm-hmm.
I do have hopefully another workshop coming up next year, but I do have a recorded workshop which is on Therapy Academy.
Okay, great. And I'll share those links in the show notes so that people can just
Okay,
click on
thank
the link
you.
and find you. Thank you so much for sharing your
Thank
time and your
you.
stories and your expertise with us.
Thank you so much, Sarah. Thank you for having me on. It was brilliant.
I hope you enjoyed this medical trauma support episode. I wanted to let you know that if you are looking for support as you're healing from medical trauma, you can join our membership community. It is called the Befriend Your Body community, and you can find out more at medicaltraumasupport.com.